We have a big goal, and until we hit that goal, you're going to hear me talking about it every year, which means that we all need to work together to accomplish it. So in 2021, we set a goal to double our economic impact from $38.54 billion, and that does not include the hospitals, to $77 billion. And I had friends who said, "Are you crazy? You can't do that." And I'm an economist, and I look at the numbers and I run the models, but more importantly, I know our people. Heck yeah, we can do that. Look at what we've done so far. In 2016, our economic impact, that's the first year we calculated it, was $23.16 billion. It is, in our last year of calculation, less than a decade later, it had grown to $43.64 billion. It had almost doubled in less than 10 years. There's no reason we can't double down and get it done again. But it will only happen with smart policies. It will only happen if we work together. The next thing that is going to reshape our state is the Arizona Health Innovation Trust Fund. Established by the legislature, the Arizona Health Innovation Trust Fund is designed to be a permanent endowment. Think savings account, investment account, engine to drive the state forward. And the way we administer it, because that's not the state's job to actually run the programs, we have AZAdvances. So the Opportunity Through Entrepreneurship Foundation is a 501c3. It is contracted with the state to do important work on our workforce, with our entrepreneurs, and to move those discoveries into the pipeline. Now, remember you heard me say that thank you to our Bioscience Caucus chairs. We got $150,000 this year. That $150,000 was specifically designed for improving health for our veterans. So the way that we did that, come on, that's important. So what we did was, as soon as we knew that the money was in bank, took a little time, we then put out a call for applications from across the state of Arizona for small businesses that had programs that could have an impact on the lives of our veterans. Those applications were then scored by leaders across the state, in our veterans community, in our healthcare community, in our scientific community. And the 3 companies, Arizona small businesses, that will be working on those grants this year are Life 365, who is working in the telehealth space to improve connectivity for our veterans so that they can get to their doctors virtually. My Health, who is working on improving the veterans experience. And Regenesis Medical, who is working to help veterans with neuropathy and other neurological problems get a relief from the pain. So I've talked about the amazing things that we are doing in our bioscience sector. And when we talk about innovation, the buzzwords are better, faster, cheaper, right? Arizona is better, you should come here. It's faster to get your product to market, you should come here. It's cheaper in Arizona, you should come here. That's somebody calling to say they're coming to Arizona right now. Other states are also investing in their bioscience sectors and are also getting great results. I got news for you. They're also getting our research and building companies, our companies, in their states, because we do not have the funding that is necessary to keep that research here. Now, you might say, well, wait a minute, those researchers should be loyal to Arizona. Those researchers have a mission to make life better for patients. And if they have to go to Timbuktu to follow the money, to make life better for patients, they will do it. And it makes me really mad when they do. But you can't blame them. So, great state of Texas, Republican state, okay, has awarded over $4 billion in what they call C-Print grants since 2010. And in 2025, they doubled down, and they've now created a program for neurological diseases. So our cancer researchers are starting companies in Texas, and our neurological researchers are going to follow the money to Texas if we don't figure this out. Now, that's not, all of a sudden the room went quiet. But let me tell you, when you are trying to bring a life-changing therapy to market, you do whatever you need to do to make it happen. And we have invested as a state over $30 billion of public and private money to get to where we are today. Every time that we see an Arizona discovery get developed in another state, we have missed the boat. The opportunity is gone. And so we really have to think about, how do we get creative? Massachusetts, everybody talks about Boston. Okay, I was actually in Boston when their mainframe computer industry was tanking, and they said, oh, what are we going to do? Oh, we got all these universities, let's do life sciences. They invested. They built. They focused. They're winning. They are a slightly smaller state than we are. So what we need to think about, how do we get creative to find the money, to invest the money, to create the cures, to create the jobs, to create a brighter future for Arizonans and their families. Because that's what it's all about. It is about improving lives. Health innovation is more than jobs. It's more than companies. It's more than tax base. When you are holding the hand of someone and you have to listen to the fact that the doctors can't do anything else for them, that's the motivation. That's the mission. It's improving lives.